Hi there! If you are watching this video right now, chances are you are probably planning on having a knee or hip replacement procedure at AdventHealth Wesley Chapel. Let me start by introducing myself. My name is Jamie, and I am the Neuroscience and Orthopedic Coordinator for the Post-Surgical Unit at AdventHealth Wesley Chapel. I'm a registered nurse that works closely with all the patients coming to our hospital for a spine or joint replacement procedure. Educating patients and their families before they come to the hospital for their surgeries is one of my main responsibilities. It is extremely important to us here at AdventHealth Wesley Chapel to make sure you and your family are prepared for your upcoming surgery. We want you to succeed and have the best possible outcomes, so that is why we have this educational video to help you know what to expect throughout the surgical and recovery process. Thank you so much for watching this video. It may seem like a lot of information to follow along with. However, if you do have any questions, you can always refer to the joint replacement booklet you were given at your pre-admission visit, or contact either someone from your surgeon's office or myself, and we will be happy to assist you in finding the information you need. The first thing I'm going to go over is a brief description of what the whole surgical process may look like for you. You should have already had your pre-admission testing appointment where you met with a nurse who went over your health history, medications, and some instructions for you to follow prior to your surgery. The next step in the process you are currently doing right now by watching this video to get further instructions on how to prepare for surgery and what to expect. Thirdly, the day before your surgery is scheduled, a healthcare professional will call you and let you know what time your surgery is scheduled for and what time you need to be at the hospital the day of your surgery. Make sure you don't have anything to eat or drink after midnight prior to your surgery. Once you show up to the hospital the day of your surgery, you will be led to the preoperative unit where a nurse will help you get ready for your surgery. You may also see someone from our anesthesia team to discuss a sedation and pain management plan with you. When the operating room staff is ready for you, you will be taken to the operating room where your surgeon will perform your surgery. After the procedure, you will be taken to the recovery unit where you will be monitored until you have woken up enough from surgery and the staff feel you're stable enough to safely be moved to the next stage of recovery. Some patients will continue to a new recovery area to further recuperate before going home that same day. Others will be taken up to the post-surgical unit where you will spend the night in the hospital. If you go to the post-surgical unit, many staff members that are part of the interdisciplinary care team will monitor you and assist you in the recovery process until it is safe to be discharged from the hospital. After your surgery, the goal will always be for you to return home upon discharge from the hospital. Your surgeon may want home healthcare workers to come into your home to further assist you in your recovery. If it is determined that you do need a skilled nursing or rehab facility at discharge, then our team will coordinate those arrangements for you. For you to be discharged from the hospital, 5 things need to happen. First, your surgeon has to say you are cleared from a surgical standpoint. Next, if you spend the night in the hospital, you will most likely have a medical doctor called a hospitalist that is there to address any medical needs aside from any issues having to deal with your surgical site. This medical doctor also has to say you are stable from a medical standpoint to be discharged from the hospital. Third, your physical therapists and occupational therapists must ensure you are able to safely be discharged from a mobility standpoint. Fourth, we need to make sure you have the necessary equipment you need for discharge, like a 2-wheeled walker or a supportive brace, for example, if necessary. Lastly, we need to have confirmation of discharge plans from our case management team. If you are going home with home health care coming into your home, we need to make sure that is all set up. Or if you happen to be going to a skilled nursing or rehab facility, then case management must make sure all those arrangements are made. Once all 5 of these steps are accomplished, then it will be okay for you to discharge from the hospital. Now that we have discussed the surgical and discharge process, I'm going to tell you different things you can do to help prepare your home for your return after surgery. We encourage you to prepare your home prior to coming to the hospital because when you return home, you may not be able to move around as easily. You will also have certain guidelines and mobility restrictions your surgeon wants you to follow initially after surgery in order to protect you and prevent harm to your surgical site. Here is a list of ways to prepare your home prior to coming to the hospital. Items that you use frequently, such as toiletries, clothing, cooking equipment, and eating utensils, should be moved to counter height level so you can easily reach them without bending or stretching. Next, it's a good idea for you to walk around your home and move things that could be a tripping hazard. Rugs, cords, or any other clutter on the floor could be moved away from walkways since you could easily trip over these things after your surgery. If you have pets, it may be difficult for you to care for them initially after surgery, especially if you have a dog that needs to be walked. When you are recovering from your surgery, you should not walk your dog on a leash because your dog could pull you or the leash could get tangled up around you and cause you to fall. If applicable, you should make arrangements prior to surgery for the care of your pets. If you do not have someone to stay with you at home after surgery, you may want to consider making some meals ahead of time that can be frozen, so you do not have to worry too much about cooking when recovering from your surgery. You will want to make sure your bed has clean sheets 3 days before your surgery, as well as after your surgery to minimize germs. Make sure you have enough clean, comfortable clothing that you can easily put on and take off after surgery, as well as a comfortable pair of shoes with closed toes that also have a closed back. Bring at least one pair of shoes and comfortable clothing to the hospital that you can go home in. And lastly, you must arrange a ride home from the hospital prior to arriving at the hospital for your surgery. The steps I just went over with you were to help you prepare your home and make it a safe environment for you to recover after surgery after you leave the hospital. In this next portion of the video, I'm going to tell you about different ways we try and keep you safe while you are here in the hospital. After surgery, there are multiple factors that could contribute to you being unsteady on your feet. Anesthesia, pain meds, vital signs, and of course, just having a major surgical procedure completed that your bones and muscles need to heal from, all can contribute to you being weak and unsteady on your feet initially after surgery. That is why we always ask that you call for help from one of our staff members before getting out of bed or out of the chair. Oftentimes, people feel strong after surgery and confident that they can walk around on their own. But different medications given to you in the hospital, along with muscle weakness post-operatively, could cause your legs to buckle, or you could feel like fainting. If this does happen while a staff member is there, they will be able to safely guide you to a sitting position to try and prevent injury or harm. If you do not have a staff member by your side when something like this happens, then you could fall to the floor and injure yourself. Now, we here know that sometimes people do forget that they need to press their call light and ask for help to get up. That is why we give you a yellow wristband that says fall risk on it, bright yellow socks, and we also utilize bed and chair alarms in the hospital. If a staff member sees someone with a yellow band on and yellow socks walking in the hall or around their room alone, then that lets the staff member know that that patient needs a buddy to walk with for his or her safety. In addition, the socks we give you have grips on the bottom of them to help make sure you don't slip and fall while walking. If you hear a bed or chair alarm go off, that is just to remind you to sit back down and wait for help to get into your room before moving about. When a staff member hears a bed or chair alarm go off, they're trained to quickly respond to the area where the alarm is because most likely someone needs help and we want to prevent falls and injuries as much as possible. Many patients also need certain medical equipment for walking after surgery, such as a walker or supportive brace. If you call for assistance before getting up in the hospital, this also assures that our staff can make sure you have the proper equipment you need to safely move about. Next, we will talk with you about physical and occupational therapy in the hospital to assist you in gaining your functional mobility back after surgery.
Hi, my name is Kimberly, and I'm a physical therapist and the Director of Inpatient Rehab and Wound Care Hyperbarics at AdventHealth Wesley Chapel. I will talk to you about what to expect after your surgery in regards to rehab and recovery after your joint replacement. Your doctor will order physical therapy and occupational therapy after your surgery and specify your weight-bearing status as well as any precautions. The staff will instruct you based on the doctor's orders. Generally, your physician will want you to get up 4 to 5 hours after your anesthesia time ends. Depending on what time your surgery ends, either the physical therapy and occupational therapist or the nursing staff will help you out of the bed. The physical therapy goals will make sure you are able to transfer in and out of the bed, walk with your rolling walker, and go up and down steps if you have them at home, as well as perform your exercises. You will receive a home exercise program prior to your surgery. Please practice these exercises prior to your surgery as long as they do not aggravate your pain. The stronger you are before surgery, the quicker your recovery will be post-op. The occupational therapy goals are to make sure you're able to transfer on and off the commode or chair and perform activities of daily living. There are several pieces of equipment you will see while we work with you. The first one is a rolling walker, also known as a two-wheeled walker. Please make sure you have the walker prior to surgery and feel free to bring it to the hospital. The staff can adjust it for you. If you do not have one, we will assist you in obtaining it. You are to use your rolling walker anytime you get up. Your home health care physical therapist or outpatient physical therapist will progress you off the rolling walker and onto a cane when they feel it is safe to do so. The staff will also use a gait belt to assist you when you are up. This is in case you lose your balance with transferring or walking. The goal is to go home after your surgery. Your doctor may decide he will want you to go home the day of surgery, which he will call a fast track. The therapist will make discharge recommendations based on your needs. Depending on your insurance, you will receive a home therapy 2 to 3 times a week for up to 2 weeks. The home health care therapist will continue to progress your activity along with the exercises. Patients generally progress to outpatient rehab after your doctor visit. Our wellness center, located next to the hospital, has an excellent outpatient rehab clinic that can aid you in complete recovery from your joint replacement.
In this next section of the video, we are going to discuss some complications that could occur after surgery and what we do to help prevent them. 3 possible complications after your surgery could be pneumonia, blood clots, and a surgical site infection. First, let's talk about pneumonia. After surgery, things like pain medication, immobility, and anesthesia lingering in the system can cause someone to not breathe as deeply as they normally would. We use a breathing tool called an incentive spirometer to help expand and clear the lungs so fluid and germs don't build up in them and cause pneumonia. We encourage you to take 10 slow, deep breaths through the incentive spirometer every hour while you are awake. You can choose to do all 10 at once or break them up throughout the hour. This part on the incentive spirometer will raise up as you take a breath in, and it will tell you how much air you were able to inhale into your lungs. While we do want you to try and get this part of the device as high as you can, it is extremely important that you do these exercises slowly. Taking a big, fast, deep breath in is not as effective in helping the lungs expand as taking a slow, deep breath is. This piece tells you how effective your breaths are. If this piece shoots up to the top, then you are breathing in too fast. The goal is to have it hover while we are slowly breathing in. When you go home, if you lose your incentive spirometer or it happens to break, you can still do effective breathing exercises by remembering to take nice, slow, deep breaths on your own. A nice big belly cough after doing these exercises is also encouraged to help clear the lungs. Now, let's talk about blood clots. After surgery, you are at an increased risk for developing a blood clot. Blood clots are serious and shouldn't be taken lightly. Blood clots often develop in the legs and potentially can break loose and travel to other parts of our body, such as the lungs, which can be very dangerous. Depending on your risk factors and your surgeon's protocol, various items may be utilized in order to help reduce the probability of a blood clot forming. These items include TED stockings, SCDs, blood thinners, ankle pump exercises, and movement. Your doctor may want you to wear TED stockings or compression stockings in the hospital and after discharge. These provide compression to the legs, which help improve blood flow and assist in blood clot prevention. If your doctor orders TED stockings for you, we will provide you with a pair in the hospital. SCDs, or sequential compression devices, are usually ordered in the hospital. These are leg pumps or sleeves that wrap around the patient's lower legs and are hooked up to a machine that pumps air into the sleeves. When the sleeves fill with air, they squeeze your leg muscles, which helps to circulate the blood in the legs. Depending on your procedure and risk factors, your surgeon may order some type of anticoagulant medication, also often referred to as a blood thinner, to help prevent the form of a clot. Although these special devices and medications are great for preventing the formation of blood clots, patients still need to be doing their part to help reduce the risk of blood clots by moving. Once you get home from the hospital, it is important that you get up and move every hour that you are awake. Exercises like ankle pumps should also be done at least 10 times an hour while in the hospital and at home. While sitting or lying down, flex your feet up and down, contracting your calf muscles. This movement and contraction of the muscles helps with blood circulation. These are a great way to help protect yourself from a blood clot, and they are easy to do. The last complication that I'm going to discuss is the possibility of developing a surgical site infection. Whenever there is an incision on the body, there's potential for bacteria to grow at that surgical site and create an infection. Here at AdventHealth Wesley Chapel, we try to do everything we can to prevent that from happening. At your pre-admission testing appointment, you should have received a bottle of chlorhexidine wash. This helps reduce the amount of germs on your body. You should start showering with this 3 days before your surgery. This is why we encourage you to have nice, clean sheets 3 days prior to surgery, and you should also not have pets sleep in bed with you during this time period as well. After cleaning the bacteria off your body, we don't want you to then crawl into dirty bedding and ruin all the work you did to help decrease your chances of an infection. Before showering with it for the first time, you might want to test it out for sensitivity to the product. You could put some of the soap on a small part of your arm or wrist, or wash your hands with it to see if you have a reaction to the soap before using it all over your body. When you start using this in the shower 3 days before surgery, you're going to do any washing you need to do, such as washing your hair, face, and genitals. Then you are going to rub the chlorhexidine soap all over your body from the neck down, avoiding the face and genitals. Rinse the soap and dry off with a clean towel. Once you get out of the shower, try not to put on any lotions, creams, deodorants, or perfumes after, because it could decrease the effectiveness of the product. If you shower the morning of your surgery, you should also use this chlorhexidine then too. Once you get to the hospital, we do multiple things to prevent an infection from occurring. The operating room is a sterile environment with special air filtration systems to help reduce your chance of getting germs in your surgical site. A dressing is placed over your incision in that sterile field to protect your incision from the environment until it has healed enough where your surgeon feels it can be left open to air and no longer needs to be covered. Throughout your hospital stay, you will most likely have a few doses of IV antibiotics, and also we will use a product in your nostrils that acts like hand sanitizer for your nose to help prevent the spread of bacteria. Our staff practices proper hand hygiene in the hospital, and as always, we encourage you to have good hand hygiene in the hospital and when you return home. Now, let's discuss how we will be managing your pain post-operatively. While in the hospital, your nurse will ask you to rate your pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain imaginable. We use multiple techniques in the hospital to help relieve post-surgical pain, including pain medication, both narcotic and non-narcotic pain meds. Relaxation and distraction can be great tools. Ice packs help with pain and swelling, and movement and repositioning can help with sore, stiff muscles. Remember, motion is lotion. Unfortunately, right after surgery, you will have some pain until you are completely recovered. However, our staff wants to try to keep the pain you do have at a tolerable level. With that being said, safety is always our number one priority. If your nurse feels you are too sleepy for potent pain medication or your vital signs aren't quite right, they will try to use other pain-relieving tools and techniques to safely alleviate your pain. A common side effect that can occur from taking narcotic medications is constipation. Staying hydrated, eating foods with fiber, activity, and stool softeners can all be used to help counteract constipation after your surgery. We here at AdventHealth Wesley Chapel don't just care for your surgical site. We care for the whole person. If you have any questions or concerns about discharge home from the hospital, spiritual concerns, or financial concerns, please do not hesitate to call our hospital and we will direct you to the appropriate person who can assist you with your needs. And like I said before, if you have any questions or concerns regarding your surgery, call your surgeon's office. And any questions about your time in the hospital, do not hesitate to contact me. Thank you so much for watching this video. We hope this valuable information helps you feel more prepared for your upcoming surgery.